Welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. Our session today is focused on HIV testing in recognition of National HIV Testing Day, which is in June. My guest, Nurse Branishka. I'm
Branishka.
good. Okay, I got it.
Branishka.
Branishka.
Yes.
Okay. Ms. Branishka Lewis will help me dissect this topic. Nurse Lewis is the acting director of the HIV/AIDS Center in the Bahamas. So at this time, I will pass the virtual mic to Ms. Lewis so that she can introduce herself.
Thank you. Thank you. Thank you so much for inviting me to speak today. And so, yeah, I mean, in a nutshell, I am a registered nurse by profession. I've been a nurse for some years, about 16 years, I think. And now I'm acting as the director of the National HIV/AIDS Center here in New Providence.
Awesome, awesome stuff, awesome stuff. So let's get into it. Nurse Lewis, can we talk HIV testing?
Yes, yes, yes.
And then we also want to touch on a little bit other stuff. But background, Ms. Lewis, can you tell us about your background, particularly as it pertains to your background working within the HIV/AIDS Center? And I guess if you can touch on a little bit of the services that you offer.
Okay, all right. So, like I mentioned, I am a registered nurse. I joined the unit in 2010. And so at that point, when I got here, I was responsible for PMTCT, which is the Prevention of Mother to Child Transmission program. So I was the PMTCT coordinator. And so, in a nutshell, what that basically means is that for all women living with HIV who became pregnant, it was my responsibility to locate these women and to ensure they were linked to care on medication so that at the end of the day, they would have babies that were born negative. And that was something that I did for most of my time here. But because, you know, a nurse, we wear many hats and it's good to touch a lot of different areas. I worked in a lot of the other areas. So after acting as the PMTCT coordinator, I was then asked to serve as the director of the unit. And so, what the acting director does, my job basically, I have oversight of all of the services that we offer here at the National HIV/AIDS Center. And so, some of the services that we offer, we talk about treatment, care, and support. And so, that's for persons who are living with HIV. We want to offer them doctor visits. They come here, they have their blood works done, as well as get their medication. We have a pharmacy, and all of those services, they are available free of cost to the client. Additionally, we have another program that's called PrEP. And what PrEP is something for persons who they are negative, but they have an increased risk for HIV transmission. And so this category would fall with men who have sex with men, sex workers. Those are some of the persons who would be a candidate for PrEP, as well as persons in serodiscordant relationships. And what that means is basically one partner is positive, the other partner is negative. So the negative partner would start PrEP, and that would offer them protection against HIV transmission. We also offer a lot of education, HIV prevention education, and of course, the one that we're here to talk about today is HIV testing, free HIV testing. That's another service that we offer here at the National HIV/AIDS Center.
Thank you so much for sharing. And your work, you're doing a lot. You're doing a lot as it pertains to that area and the prevention of HIV and AIDS transmission. And so, in your role, Nurse Lewis, as the acting director of the HIV/AIDS Center, um, what I know you talked about the services, but what really is the role of the center in addressing HIV and AIDS in the Bahamas?
Okay, for us, we have oversight for all services related to HIV in the country. And so for us here at the center, it's to provide to coordinate services around the nation. And so you would find us, for example, we have Grand Bahama Health Services. So we work very closely with them so that persons in Grand Bahama, they have access to the same services such as medication, as well as the blood works that test for CD4 count and viral load. We also work with other clinics throughout the country where we would send medication to those islands and ensure that again everyone has access to the medication, because it's kind of pointless to have all of these drugs and persons who live in the southern Bahamas or the northern Bahamas, they don't have access to it. So we work along to ensure that they have all of these things done. We're responsible, sorry, for monitoring of services, and so that's in both public and private sector. So we still, for us to be able to say at the end of the year, this is how many new cases we had. We've had a decrease in AIDS related deaths. We need to have a surveillance unit. We have an epidemiologist who helps to guide that report so that we know where we are. And that also helps us to guide our services to know where we need to target our interventions in our new year or in each new time period.
Thank you. And so this is a pretty simple question. I know it seems simple, but just to broaden our understanding is really what is HIV?
Okay, and it's not simple because we can't assume that everyone knows everything. And so I always encourage persons, especially when I'm doing talks like this or I'm having it's community outreach, I'm doing some type of education session, like no question is silly, no question is simple. You ask the question because you don't know. And my job is to make sure people know. And so HIV, those letters HIV, it's a human immunodeficiency virus. And so a virus is like, in simplest terms, is a teeny tiny germ. And when this gets into a body, it causes a lot of problems. And so now when we talk about the ways that HIV, human immunodeficiency virus, gets inside a body, that's where we talk about the ways it's transmitted. And so I don't know if I jump in the gun and answering questions ahead, but we want to look at first it's transferred sexually. So when we talk about sex, we're talking about vaginal sex as well as anal sex. It can be transferred mother to child. So that's where you have a woman that's living with HIV while the baby is inside of her. It can happen while the baby's on its way out during the delivery process or afterwards if she breastfeeds the baby. And finally, through sharing needles. And so we talk about needles for drug use. For us here in the Bahamas, that's not too much of a concern. Our concern, the one we really need to pay attention to, is sexual transmission. And so that's something we really got to pay attention to. All right.
Thank you. Thank you. You mentioned a point. You talked about you mentioned a point. You talk about the focus on sexual transmission. Um, Piqued my interest when you mentioned that. Why is that? Why is that a major focus for us?
For us, because remember now when I spoke about the services we offered and I spoke about our epidemiologists. And so for one of the ways for a country to know how best to respond to their HIV, their AIDS epidemic, they need to know where it's coming from, which groups you're seeing it in. And so for us here in the Bahamas, we notice it's through sexual transmission. Now, the other methods that I mentioned are through sharing needles. Other cities, other countries like Eastern European countries, and some US states, some of the northern US states, they would more focus on, they have that drug use problem. And so that's going to be their challenge. And so that's why, even though it may sound like a very not interesting job, or oh, we don't really need to know these. No, we need to know the numbers because they help drive your program to know this is what intervention we need to focus on, this group, this who we really need to focus on. Because if we don't know that, then our interventions are going to be everywhere and not focused on where we putting it. And as a Ministry of Health, as a government entity, and health globally, health tends to be one that drains, that has a limited amount of resources. And so by that measure, whichever resources we have, we need to use them smartly and strategically.
Nurse Lewis, I like that you mentioned that your efforts are strategic, and so you know what areas you need to target. And so I'm glad that you mentioned that, and that the focus is on sexual transmission because, like as you said, even though there are other means and other methods, we know the context of our country, and so you know which area to focus on. So
Definitely.
I'm glad that you mentioned that. And then when it comes to testing, are you satisfied with the HIV testing initiatives in the Bahamas? And do you believe that testing impacts the rate of transmission in our country? Do you think that it
Okay.
helps?
I always think there is always room for improvement. And over the past year, in terms of the amount of testing that we have had, we have not had as much as we would have liked. We are accustomed to going out in the community, trying to get as much people as possible to come out. We wanted the big crowds, we wanted the long lines. You know, we would have regional testing day in Rawson Square, 800 people, 900 people. We go to the University of the Bahamas, the next couple hundred. And so that's what we were accustomed to in the past. But our reality now does not, it's not safe to have such large testing events. And additionally, because now with social distancing, we can't accommodate as much people as we would have liked to accommodate in the past. And so all of these are now challenges that we face in today with testing. And so we are still available. We just want people to know testing is still available, even though it's not on the big, large, grand scale that we would have done in the past. And the second part of your question, it spoke to, um, you can repeat it, please. Sorry.
Sure, no problem. The second part would have focused on um, whether or not you were or what do you believe testing impacts transmission? Do you believe that it
Definitely.
put a dent, and go ahead.
Definitely testing it does because knowledge is power. And so once persons are able to know their status, let's say we have a person who is positive, who is now living with HIV, and we'll use my favorite group, and that's the women living with HIV. So once we find out that okay, you're positive now and you're pregnant, we're able to get you the treatment, get you on medication, which is going to reduce transmission to your child. Additionally, we now have a campaign, and this one is global, where you would hear U equals U. And so, what that means is undetectable equals untransmittable. And so, what that means is that if a person is living with HIV and their viral load, which is the amount of HIV in their body, is at what we call an undetectable level, that greatly reduces the risk of HIV being transmitted during a sexual encounter. And so that's why you'll find testing is important because once persons are aware of their HIV status, they can get the treatment that they need. And once they're undetectable, that greatly reduces. It's almost a negligible chance of it happening, of transmission happening. And so testing, it helps to prevent transmission. Additionally, it provides, sorry, testing it provides us with opportunities to provide education and information to persons. A lot of persons, they're not aware of a lot of things relating to HIV. And so again, you are able to adjust your behavior if need be, because you may have been thinking that what you was doing was safe, but now you find out from the professionals that, hey, I need to revise what I've been doing so that I am negative now and I can remain negative in the future.
Thank you for sharing that. That brings me into my next question. In that, do you think persons realize the importance of getting tested for HIV, and why is it important to get tested? Why is it important to get tested for HIV?
More and more people are realizing that, hey, this is something that I need to do. And we see just the fact that persons are willing to just come and have it done. We have some persons that are like, okay, it's time for me to have my test again. And so, they show up and get it done, get the prick. Now, I mentioned again, knowledge is power. And so the importance in testing is that if you are positive, we're able to provide you treatment. Studies have shown that the earlier you start treatment towards when you first infected with HIV, the better your overall prognosis. And so the earlier you test, then we can get you linked to care, whether it's one of our doctors here in our unit, or if you decide you want to go somewhere else, but we're able to help you facilitate that entire process. And again, if your test is negative, we're able to help you to make better future decisions that reduces your risk of HIV transmission.
Thank you for that. And with that, we know that there are risks involve their risky behaviors some persons take. So, what puts an individual at risk for HIV?
Okay, so persons who are at risk are persons, once you're sexually active, you're at risk. And so we encourage you to know your partner status because, again, not knowing your partner status, you're at risk because you have no idea who this person is you're having sex with. Another way is lack of condom use or incorrect condom use. We have to, yes, we have a lot of persons. Yes, nurse, come here. We have persons and they're like, yes, nurse, I use a condom all the time. But when you start to get to the nitty gritty of it, they're not using it properly. Condoms are supposed to be used first, before we even get to the usage, they're supposed to be stored in a place that's cool. You see this nozzle sign out there? And these people, oh, as keep it in my glove compartment, as keep it in the back trunk of my car. Seriously? Leave a water
Also,
bottle.
it's supposed to be stored in a cool place.
It should, yeah. So,
Okay.
right. And so, yeah, you may be using that because, you're driving, getting dark, and you pull up to one little, one little beach where no one is drive past, something like that, and you open the glove compartment. That don't work because that done been in your car all week long or whenever you buy it. Yes. So keep them cool.
Wow.
Next, condoms expire. They have expiration dates. A lot of people they don't realize that as well. So you want to make sure that you ain't using no condom with them been expired from 2018. Check. So see that's why when you know you have your stash, you don't wait till you're in the moment because sometimes when you're in the moment, so beforehand you just say, okay, let me look at this. Let me check the date on this. Make sure she's still good. Make sure ain't no holes and little tears in that package. Then again, when you're in the heat of the moment, for some odd reason, we get so rushy, we want be biting it open. Why you gotta bite it? You could just tear it open. Them little ridges along the pack, they there for a reason. They to help it, make it easy to tear that open. Cause see, when you bite it, again, it's a possibility that you bite in the condom. And so that's why I say, person say, yes, I use a condom all the time, but they may not necessarily be using a condom correctly. Last thing on the condom, when we're talking about lubrication, don't use no Vaseline, don't use no lotion. You want to use a lubricant that's water based. Vaseline and oil, they can cause problems with that condom as well. Yes.
Can you explain?
Because of the oil, it creates friction, and so that could break down the condom. And so that's why we suggest using a water-based lubricant with your condoms if you need that extra slip and slide.
Interesting. So, for the persons who may be interested, can you recommend any water-based lubricant?
I know the KY jelly, that
Okay.
one is a water based. Now, I can't speak for any other, but normally, like you'll have, if you look at the package, it'll have whatever the brand name is, and then it'll be like in a little smaller writing, and it would say water based. So now, if you get it and you look in the back on the ingredients and you see oil is the first, now you don't want that. Oil is the first ingredient. No, we want water based.
Ms. Lewis, you've given us some interesting facts, and that's why it's so important for these sessions. And like you said, knowledge is power. So who would have thought storing your condom in your glove compartment will impact the condom. Who would have thought? So these are definitely important points that persons need to take note of. So I want to thank you for sharing that. Even older condoms as well. You have had those condoms for years. You know what I mean? You have to think about this expiration date as well. Yeah. So when we talk about risk, and persons engaging in risky behaviors, I would share with you the the meme of the hot girl summer. The summer months is approaching, and some persons, they want to have a hot girl summer. And so in my research background, I found that one definition of, well, in the urbandictionary.com, it refers to hot girl summer as girls taking over and expressing their inner hope. So, how can an individual enjoy a hot girl summer and protect themselves? Nurse Lewis?
So it depends on what degree of hotness you want. So if you want to go out, one of the things what I want to encourage persons, you always want to protect yourself. When I'm talking about prevention, I go A B C Ds, right? So A is abstinence. You ain't doing nothing. But for hot girl summer, we ain't trying to abstain. So then we go B, which is being faithful, being in a monogamous relationship. Again, I don't know how hot you want to be this summer. Okay, so that may not work for you. So that's where the C comes in, just that consistent and correct condom use. And then D speaks to drugs or alcohol as well. It don't begin with D, but listen. So we encourage you. So it's just drugs. So to be careful when you go out with doing drugs and drinking alcohol, because sometimes when you get drunk, you get high, you make a lot of decisions that you will regret in the morning. And so for hot girl summer, if you want to go out and you want to party and you want to have fun, at least try to have someone, a trusted person with you, a designated driver, who's going to pull you back and be like, Bernishka, come back. No, you aren't going to do that or whatever. So that's one of the things which you could do to try and protect yourself. Now, for some persons, hot girl summer, it consists of people who you have a phone, you have a couple contacts in your phone who you call when you want to have a good time. So at least bring it up to them. Hey, can we at least have a test? Let's go and do a test so that you know for certain what you're dealing with. You're not just going off mouth because mouth could say anything. Yeah, I straight. I've been done today or whatever. No, make sure you have the test done so at least you would know for certain. I'm not up here to be preachy and judgy and say, oh no, you shouldn't do this or no. The only thing I am going to ask you to do is try to do it to reduce your risk. And so that's by testing and that's by consistent condom use. Definitely. That's way you still have your hot girl summer, but you want to protect yourself during that time.
Okay, so hot girl summer is on.
Because you know,
Nurse, but Nurse Lewis, I wanted to ask you. You talk about getting tested. I wanted to ask you. Um, you have some person stay in love. They meet this person, they fall in love, and they want to ask about getting tested, but it's not an easy question to ask. So how do you get around saying, "Hey, I need you to take an HIV test"?
it's not the most comfortable discussion, but that's something that we have to, with time, you will get better. And so you just have to realize that this is something you need to discuss with this person, especially before it gets to the point where you've already had sex. Okay. I mean, it's never too late to have a test, but the ideal situation is for you to do it before so that you're aware of anything that's happening before you go there, literally go there. And so it's not an easy discussion to have, but you just want to sit that person down and do it together. I think one of the challenges comes sometimes where one, like for example, if I'm in a relationship with John, I'm just saying, John, you need to go and do a test. And so it's almost as if I'm accusing John of something, and I'm saying, oh, I don't need to do it, only you need to do it. But if you bring it where you say, we should do this together as a couple, this can be a couple's activity, then we're on the same playing field. Like, I'm not putting all this stress and all this burden on John, but I'm saying, John, let's do this together. And this is something where it can actually bring us closer because now we can be more intimate. That's a very personal thing. And it shows a level of trust as well, that you're trusting this person and they're trusting you to go and do this test together.
Thank you, thank you. You know, because you have persons, you know, they say I'm straight. You know, you don't have to worry about me. I straight. You know,
Mhm.
it's kind of difficult to try to navigate through those discussions.
And I
So,
think too, sorry, but it takes patience too, because some persons, they are just genuinely afraid to
mm,
know, because and you can ask a lot of people, especially when it's their first HIV test, it's a daunting thing to do. And so now all of a sudden, John never had to think about this, but I'm like, John, I really need you to do this test. I really, so I need, you also have to have patience with that person and don't expect that the first time you bring it up, that it's automatically going to do. So you just want to, not to be a nuisance, not to be a nag, you want to be understanding. But then at the same time, you also want to stand your ground and say, John, like, this has to happen. I need this test. We have to, another line saying you, we have to do this before we can move on. And so it's very important. But you don't let them tell you, oh, I don't need to do a test because I work this place. This is my job. And only if they wouldn't let me be a nurse or police or be or defense force or whatever. No, everyone, you got to do a test.
thank you, thank you. Um, what happens next? I mean, it's a scary. Sorry, sorry, I'm in a busy intersection thoroughfare. But what happens next? I mean, it's a scary thought to think about. What happens next if a individual tests positive for HIV? What are the next steps?
Okay, so your next steps, when we counsel, we want to make sure that you understand what this new diagnosis means for you. Our goal again is to link all persons living with HIV um, to care. So we have what we're working towards now. It used to be our 90 goals. We're now at 95, 95, 95. And these are global goals, which speaks to 95% of the persons in your country who are positive that they actually know their status. And then 95% of those persons are linked to care. So they're linked to care, which means they have been sent to a doctor and the doctor started them on medication. And then the final 95 speaks to being virally suppressed, which means that the HIV is at the lowest possible level in your body. Okay. And so that's the goal. So when a person tests positive, our goal is now to link that person to care. And so fortunately for us, we have a doctor, so you can do a test here, and if your test is positive, you can see the doctor here, and you can also get your medication right here. So it's a one-stop shop. Additionally, we would do those blood tests that I mentioned, the CD4 count, which is your good cells, your white blood cells. I like to call them your soldiers. And we also would do your viral loads, which is the HIV level in your body. We also going to do just some regular blood works, looking at your iron, like your CBC, so that's checking your iron level, your white blood count cells, red blood cells. Um, we'll look at liver and kidney functions as well, and also do some tests for hepatitis B, syphilis, and maybe even throw in a few other STI screenings. We follow you up. We don't just throw you there. And any referrals that you may need, we help. We help you to organize.
Awesome. And when it comes to protection, how can an individual protect themselves from um, prevent HIV? How can they
Okay.
protect themselves? Yeah.
All right. So If you are not sexually active, that's protection right there. That's the one that's 100%. But for persons to decrease your risk, we encourage reducing the number of sexual partners you have, because the more partners you have, the more chances for you to increase HIV transmission. Condom use, consistent and correct condom use. We encourage you also to know your partner's status, because then you will know how to proceed, how to move forward. So I'm not saying if you find out that your partner is positive that you absolutely have to leave that person. No, you just know now a few things. You have options where you can consistently use condoms. You can start PrEP, which we have available free of cost. For the person who is positive, they now realize that now they should work extra hard to be virally suppressed so that they can offer additional protection to their negative partner. So those are some of the ways that we can avoid HIV transmission.
Thank you. Thank you. And lastly, as we come to a close, do you have any additional comments that you think persons may need to be aware of? Anything that they should know about?
Yeah, we just still want to encourage you to get tested. I know the buzzword is COVID test, COVID swab, and no, yes, that's important, but HIV is still here. We still have work to do. We have not ended this epidemic as yet. And so we just really want persons to come on and have the test done. We encourage persons who know they're living with HIV. You may be in the audience listening right now and you are not on medication. So again, we encourage you to reach out to us so we can get you back on track, get you back in care on the life-saving medication, because with medication, this improves your health, your quality of life, and it saves lives. It saves lives.
Thank you, Nurse Lewis, for
Thank you.
joining us today.
That went by
I
so quickly.
listen, I learned some new stuff from you today as well.
Knowledge has taken place.
Yeah,
Learning is taking place.
definitely. So, do you have a page? Does the center have a page you can share?
Yes, we are on social media. We're on Facebook, and it's the Bahamas National AIDS Program. So I encourage you to follow us. You're able to get information on events that we're hosting, on our hours, any changes to our schedule, services offered, all of the good things. So we really encourage you use that as a way to get in touch with us. We're active on it. You shoot us a message, and we answer.
Thank you so much, Nurse Lewis, taking time out of your busy schedule to talk to us about HIV testing. I appreciate you for sharing it with us today.
Thank you. Thanks for having me.
Thank
Bye.
you. Sorry?
No, that's it.
Okay, so I would like to thank our viewers for listening in. You can always comment under our videos, let us know your thoughts, and let us know what you want us to talk about. Again, we would like to thank Nurse Lewis for joining us in this session today. And if you would like to be a part of our talk, you would like to introduce a topic for discussion, please message us or send us an email. We want to hear from you. At can we talk 242 at gmail.com. You can also subscribe to our social media channels. We're on YouTube, Instagram, and Twitter and TikTok. So I'd like to thank you. Good evening, and good evening, Nurse Lewis. Bye. Have a good one.